This is the Whole Food Revolution team, and I'm Ronit. I'm a life coach.
And I'm Nelum. I'm a GP. So today we are going to talk about, it was really interesting, Ronit. I saw one of my patients the other week, and her story, she has a fatty liver. And it's a lot of people have fatty liver, as you know.
Yes.
But this particular lady, so let me tell you. So this is a lady who is in her 70s, early 70s. She's been doing low carb, whole food, prioritizing protein, all of that for probably the last 2 years, doing really well. She has type 2 diabetes. She's come off her medication.
Wonderful.
Everything has improved, apart from the fact that her liver function tests were constantly kind of not getting worse, but they were not getting better. Now, this is very unusual because generally her liver function, liver abnormalities were due to a fatty liver. And fatty liver is reversible. It's a reversible condition, and when you are on a low carb lifestyle, it reverses very quickly. So I couldn't understand what was happening. Like, why, despite all these improvements, why was she still having this problem? So when I look back, when we talked about it, she's been my patient for about 12 years, but she had this issue for about 15, 18 years when we looked back at her results. And the thing is that I've also only been on low carb and, for the last 3.5 years. And I don't know whether you realize that most doctors don't really know a lot about fatty liver. We think, and this was me as well, that fatty liver is caused by eating fat and high cholesterol containing foods.
Some of them say it's because you drink too much
alcohol. No, that is also a cause.
Yeah, I know, but
yes, that's the first thing you think about.
Yes, exactly.
But mostly from a diet point of view, I used to say to my patients, oh, you've got a bit of fatty liver, just reduce the fat. Okay, but we now know it is nothing to do with fat. It's if you're eating excess sugars and carbs, that gets converted into fat in the liver, and that fat, some of it stays within the liver. So this lady, obviously, a long period of time where she's been eating, not eating in the right way to reverse her liver condition. And so what that's meant is that this process, when you have fat in the liver, the liver cell can't work. And so then there's inflammation and over time scar tissue. And if this, and beyond that, what happens to the liver is irreversible. And from that scar tissue, it can lead to cirrhosis of the liver. And then from there, it could then go on to liver failure and liver cancer.
So I'm actually sure that she can still.
Well,
if she will do fasting and
wait. So what happened was, though, that we did some imaging, and her liver has now progressed onto liver cirrhosis.
Oh.
So this is an irreversible condition. So it doesn't mean that she's going to go on to those liver cancer and liver failure, but there's a risk that she may. And the reason I'm telling you this story is really because, there are times when it is a little bit too late, and not to wait. We have to do this process now, because there could be a time when you can't reverse it. The body is amazing, and the body is able to regenerate and reverse a lot of things, but there are a few conditions that you can't. Because I think,
and I think it's also, look, we're in this industry, and we're very, very excited. People come, they have health issues, and we just say, okay, let's just slowly move it, and most of them do actually change what is happening. But the thought of, okay, I'm going to eat as much as I want, I'm going to do whatever I want, and then when it's right time, I can change it. No, sometimes you can. Now, I can tell you a good example of how it changed, because I went to see my doctor. It was years ago. I came and did some blood tests, and she said, oh my God, you have fatty liver. How much do you drink? That was the question.
Yeah. That is the first question you will get
asked. How much
asked.
do you drink? I was like, well, I don't drink at all. So it's just because I don't like it. But anyway, so I said, no, I don't drink. And she said, oh my God, that's really, really bad. Anyway, she said, you have to be on medication and so on. And I said, look, I like, that's not me. How about we'll check it again?
Yeah.
I was hoping that I'd come 3 weeks later and be different. Anyway, I came later. It was exactly the same. She checked fatty liver. Anyway, she said to me, okay, you go and take the medication.
Sorry.
That's not my thing. So I said to her, just give me several months and I'll do this thing. Anyway, I went to check and stuff things, went to check the emotional bits.
Yes.
When things are stored in the liver, liver is the anger
Yes.
organ. And I found out things that I was angry about. I think I've checked back then, they said that we need to eat a lot of liver.
Okay, yes.
Milk thistle was something that cleansed the liver. Anyway, so I said, what do I have to lose? I'm just going to try. Anyway, I did it for about 3 months. I ate really, really well.
Were you low carb at that time?
I was more than low carb. I was actually keto.
Keto, okay. Yes.
So I was keto. I was more strict about it. And I was like, keto was very easy for me because it was like, you're not hungry. That's the best thing in the world.
That's the main thing.
The best thing in the world. So anyway, I did it and I came back after 3 months and she checked it and she said, oh, wow, that's a miracle. That it's just that's what the doctors say when they cannot explain. It's recovered. So she said that was a miracle, and I said, well, and she said, no, I think no, I don't trust this thing. I want you to go and do an X-ray. So I went and did an X-ray, and basically
an ultrasound scan.
Yeah.
Yes.
And they said, no, don't have
there
anything.
was
It's fine.
Yeah.
Now, can you imagine someone not like me, okay, that says, okay, the doctor said,
It's fine.
I just take whatever the doctor says.
Yes.
Now, the thing is this, the medication or not eating fat is not going to make it
any better.
So you may not have, like, she did ask me, do you feel anything? I was like, no, I don't feel anything. I was like, so she couldn't even tell me you'd feel better. I was like, no, I didn't feel anything when I was fat, and I was, when I had fatty liver. So I think when you're taking a medication, you are actually not taking care of the problem.
No, because
so it postpones it.
Yeah, absolutely, because not a single medication that we have actually works at the level of the cells. They work downstream. So we can never actually kind of resolve the problem from a metabolic point of view.
Of course.
Yeah. So yeah, you are absolutely right.
Yeah. So taking medication, it's not only not to mention that it's not healthy for us and our gut biome doesn't like all those things and stuff. Let's ignore that. But it's actually postponing you from
getting well.
Yeah, from working on it, from making it better.
Yes.
So this woman, if that started, the blockage was, I don't know, 18 years ago.
Yeah. So I mean,
so until 2 years ago, whatever she got, whatever tips she got, don't eat fat, all those things, basically postponed
her. Yeah. And it's such a pity because she has worked so hard and she's off all her diabetes medication. She feels amazing. But it is, so it was, anyway, but it's, we'll do the best and see how she goes. But I thought that it was a good point to make, that these things, they do come with their dangers. Fatty liver, despite, 30 to 40% of Australians having it, most people feel that it's like, oh, it's fatty liver.
Oh, well, actually, it's the same as diabetes. Years ago, when you had diabetes, it was like, whoa, how many people had diabetes and so on. And now it's like, for God's sake, it's almost like every second person has diabetes, and they treat it as if, well, there's nothing I can do. It's like, what?
Yes,
there's so many things you can do to help it, and I think fatty liver becoming that.
Yes, it's exactly the same process. So anyway, so just wanted to bring that story to you. Just
when do you need to take care of your health?
Now.
Well, I should have said yesterday, but hey, yesterday's not coming back.
Yes.
Now.
Absolutely.
Now. Always now. It's the same as having dementia when you are a certain age. It didn't start yesterday.
No.
Not a year
Absolutely.
ago. It starts years of building up, and nothing is this, it doesn't happen in straight away.
Absolutely.
So take care of yourself, take care of your body, and you can heal your body if you just work on it.
Yeah, absolutely.
Now.
So have a good day, and we'll see you later.
Yeah.
Bye.
Bye-bye.